Hello, I'm Amy Caples, Assistant Professor of Media Studies and Production at Temple University, and I'd like to welcome you to the result of a very unique partnership with Temple University's School of Pharmacy and the Institute for Safe Medication Practices, better known to you as ISMP. As you may know, ISMP is the nation's only nonprofit organization devoted entirely to preventing medication errors. In this exciting new video newsletter series, we're going to provide you with updates 4 times a year on the most urgent safety matters in the healthcare industries and bring you recommendations from some of the leading experts in patient safety issues across the country. I will serve as your guide along the way, and we'll learn a lot together. So let's get started. We're going to begin this series with a topic that's considered an essential part of healthcare delivery: IV push medication use. More than 90% of hospitalized patients receive some form of intravenous or IV therapy. But while the administration of medications by the IV push route has become a routine part of patient care, the lack of generally accepted safety standards for IV push medication use contributes to the potential for patient harm. Variation in practices related to preparation, labeling, and clinician administration of IV push medications hold the greatest cause for concern, but also the most significant opportunities for safety improvements. With us now is registered nurse and vice president of ISMP, Susan Paparella, who will share with us some of the key findings and recommendations from ISMP's recent national summit examining IV push medication safety practices. Susan, welcome and thanks for joining us.
Thank you, Amy.
So first of all, let's talk about, with so many types of medication errors that occur, why is Summit to focus just on the safety of IV push medication use?
So in the hospital setting, medications are commonly administered by the IV push route. And studies have shown us that by this route, there's error rates are as high as 73%. So it's very concerning to us. And we know there's system issues that contribute to this, such as how drugs are, concentrations are manufactured, how they're packaged and labeled, and the availability of ready-to-administer products.
Okay. Now, reading the best practice statements from the summit, it sounds as if practitioners perform a significant amount of dilution of injectable medications prior to administration. Why is this problematic?
Well, there are legitimate reasons why medications are diluted before administration, but what concerned us was the seemingly routine and sometimes unnecessary dilution of medications at the bedside. And we saw risky practices such as syringe to syringe transfer of medications, the use of commercially available products as a vial, and the use of flush syringes, sodium chloride flush syringes, to either dilute and then administer medications.
Well, you mentioned the use of a pre-filled syringe of sodium chloride flush, for example. Can you explain why this may not be the best choice for drug reconstitution or dilution during preparation and administration?
Right. So the FDA has approved these as a device. They are actually never been tested or approved for the use of medication dilution or administration. And manufacturers are aware of that and actually have taken the gradations off the syringe, so it makes it difficult to measure a medication. And also they've put warnings on it that say for push only. So we want to make sure that practitioners aren't using these to dilute and reconstitute medications.
I understand that there is an entire set of IV push medication safety guidelines posted on the ISMP website that outline 29 best practices. Would you say that these guidelines are directed at nursing professionals?
Certainly nurses are the ones that give the bulk of IV push medications. However, there's a lot of practitioner types: physicians, anesthesia providers, medical technicians in procedural areas that also do IV push medication use. So we would say these are for all types of practitioners. And we would hope people would go to our website and download these and use them as they develop their best practices. And they can be found on the ISMP site, as you said, at www.ismp.org.
Susan Paparella, we thank you so much for your insight. We appreciate it.
Thank you.